Hello and welcome back for our next session. We're going to have a discussion now about financial wellness. And I see this discussion in many ways as sort of a bridging point between the discussion we had yesterday about mental health, which financial wellness is very much related to. A lot of stress is related to people's financial circumstances, and particularly with the pandemic and the effect that's had on employment and earnings. We're obviously seeing the impacts of that. At the end of today, we're going to have a session on sort of systemic change, and our chief economist, Dana Peterson, is going to be presenting some stats around wealth and income and the disparities related to both race and gender. So it's something that speaks very directly, I think, to the issue of diversity and inclusion, but it's something that doesn't get the attention it deserves. So to give it that attention, I'm really glad to have with us a couple of speakers. We've got Tom Spann, the CEO of Brightside, who are one of our sponsors for this event, and we certainly appreciate their contribution. And he's joined by Tina Gilbert, who's the Managing Director of Management Leadership for Tomorrow, and she was only able to join us by audio. So we're going to try and wrap the session up. We'll wrap up a little later than was planned, but we'll catch up in terms of time, and everything should be okay. So, Tom, I will hand it over to you. Thank you very much.
Tina, do you want to get us started?
I'm sorry, I was waiting for a different cue. So forgive me for only being able to join by audio. But after, I guess, 18 months of successfully working from home, it's about time that I had my first big technical issue. But as mentioned, my name is Tina Gilbert. I work for an organization called Management Leadership for Tomorrow. It was founded 18 years ago by John Rice, who's still our CEO. And it really has a mission of helping to establish economic mobility for individuals, build and develop diverse leaders, and create inclusive and diverse work environments. And as mentioned, I am excited to lead our advisory services side. But instead of calling myself an advisor or consultant, I like to refer to myself as a DE&I navigator, really looking at organizations that are needing to make tough decisions around diversity, equity, inclusion, and belonging, and providing the advocacy, the information, and the facilitation that they need for effective decision-making. And so when Tom asked me to join this session on the intersection of financial wealth and DE&I thought what a more interesting topic around navigation than this. And so with that, I'll thank Tom for inviting me and allow him to introduce himself.
Thanks, Tina. I'm Tom Spann. I'm the CEO of Brightside. This is my third job out of college. The first one was with Accenture, where I had the privilege of working with Tina for a number of years. We were both in the consulting and navigation space. 15 years ago, I left that to start a company called Accolade. And I really started just to live up to the expectations of my daughters. They were 12 and 18 at the time, and I felt my time was going to be better spent trying to do something that would help people. And it turned out it probably helped me more than anything. It really transformed my life because I learned so much about what working families are struggling with in navigating a difficult healthcare system. Accolade was a pioneer in the healthcare navigation space. And I learned how important finances were to healthcare decisions. 70% of the time people interacted with us, it was almost as much a financial question as a healthcare question. Is this going to be covered? What is my, out-of-pocket cost? Is my doctor a network? Those kinds of things. And hired a new CEO for that 4 or 5 years ago. And one of my customers, the late Sean Levitt, who was running benefits at Comcast at the time, came to me and he said, Tom, financial stress is costing me $250 million a year for my 100,000 employees. I'm wondering if there isn't a similar navigation kind of company that could be started to help people with their finances. And that was the genesis. Sean's idea was the genesis of what is Brightside today. And Sean could really relate to it. He grew up being kicked out of his house as a young teenager, basically caught being gay, and was homeless at times, lived paycheck to paycheck for much of his career, and knew that impacted his ability to get work done. And so he believed in this mission. And so that's a piece of what we're carrying on today. So, it's based on that we started Brightside.
Excellent, Tom. So, last year there was a call to action around companies and how they should implement workplace policies that advance equity. And so what I want us to do, really, because as you heard, Tom and I have worked together for a long time, we want to have a conversation with you all about equity and connecting the dots to financial health, and then eventually talking about how this is not just a comp ben topic, but really how it could impact the lives of employees and really create a diverse, equitable, and inclusive environment. And so with that, just to provide a little context to some of the things that MLT has done, is with the call to action last year around how companies should implement policies that truly advance equity and really move beyond kind of the random acts or the programmatic approach, but more specifically look for ways to improve racial equity while dismantling racism and promoting equity across the board when you look at all the different diversity dimensions. In that work, we saw the concept of equity being brought to conversation and very intentionally being added. So, for example, DE&I, diversity and inclusion, became DE&I in less than 2 months without even, a big formal memo coming out. It was just a heightened call that equity and understanding beyond individual action, but systems and processes, what needed to change. At MLT, we saw this as an opportunity to define standards. There's a lot out there that compares companies to where they are with their peers, but we wanted to create a true standard that just does not define the scope of equity, but truly provide standards to measure progress. So that's what this is all about when we think about it. How can we truly examine how we're moving the needle and making the type of impact that we want to have? And so at MLT, we took a further step to define something called Black Equity at Work. And this program was specifically developed to provide guidance to all of the corporate speak and corporate call to actions that were happening literally a year from today. And we wanted companies that were beginning to speak about this to have a yardstick on measuring how they were progressing and how they saw equity truly coming to life within their organization.
Tina, that's neat. It was exciting, exciting to reconnect with you at the beginning of this year because, I approached you because I was seeing that I thought benefits in most major employers were actually perpetuating rather than resolving systemic racism. And so when I saw the Black Equity Work certification program and all that, I just was excited to see people taking a look at these systemic issues inside of large employers or employers of any size. Maybe you could talk a little bit more, help me and the audience understand what it is and why it's relevant for employers.
Great question, Tom. So what it is really is a first of its kind, comprehensive, rigorous, but achievable standard of what good looks like. I mean, when we think about Black equity, the components we look at are the traditional representation, inclusive environment, but we're really expanding and pushing on this lever around employee comp and benefits and thinking beyond the standard view of pay equity analysis. We've also included racially just business practices as well as racially justice contributions and investments, because a lot of organizations were making a call around how much money and resources they were putting into some of these issues, and we wanted to make sure people understood where the impact could really take place. The Black Equity at Work certification, I want to emphasize, it's not about calling out employers. It's really about calling them in and helping to provide the clarity that's needed on this journey that everyone acknowledges they're on. No one sees DE&I as an endpoint, and so equity is an important part of that journey, and we want employers to know how they can be successful as they take these initial steps. So far, 35 companies have signed up, and it's really about defining goals and aligning their actions over the next 3 to 5 years. Most organizations are thinking about it in that 3-year window to balance the urgency with what I call the systemic change that's required. And we've launched already with 2 cohorts, and we plan to have another 2 or 3 cohorts this year.
That's neat. Tina, one of the things I can see is the parallels between what you've created to make progress on equity for corporations and, how we think about financial health in our clients, right? You may have big goals and you may have assessments about, what good looks like for financial health. It's probably personalized for each person. But you've got to start with some small steps. Like how does an employer start? What do leaders need to do to get started in a way that makes a difference?
Yeah. Certification is at the 5th or 6th step. The first phase really is leaders shifting their mindset to a business equity framework that's really about establishing change, right? And so that mindset shift that is talked about very often is recognizing as you're leading organization, it's not just about your personal skills and your personal traits, but what you're doing to enable the systemic changes within your organization. So how business leaders are thinking about their investments, how leaders are thinking about their practices, their processes, and as you're going to talk about a little bit more, their benefits, right? What are they really doing that's going to enable change? The second part is once you have that mindset, we talk about DE&I plans or strategies. They need to have the same strategic rigor as other parts of the business. And this has been consistent through, my 15 years of focusing on DE&I, right? You need to connect it to how you think and manage the other parts of your business and ensure that you're understanding the root causes to what is going on. And that's really what I call the third principle. Before you begin actioning, before you begin putting, plans together, be sure that you understand the lived experiences of those you are working to solve for. And so really understanding the lived experiences of those marginal communities, when you're in the U.S., how you think about it from Black and brown employees, when you look at it globally, economically marginalized, gender marginalization, make sure you're understanding the root causes and approaching it for solving it for them, because as you solve it for them, you address it for the whole.
Thanks, Tina. I can relate to that, as you know. As I mentioned, my time at Accolade really transformed my understanding of the lived experiences of families living paycheck to paycheck in this country, and my time at Brightside is doing that even more so. But these are good people trying to do the right thing for themselves and their families. They just, need some help. What do you think is the role of the employer in helping women and people of color show up as their best selves at work?
So when I think about the opportunity to make an impact for employers, it is moving beyond kind of individual actions and opportunities. It's where you are able to leverage the strength and the power and the influence of the organization. So I do believe that part of that is the Comp Ben program, right? Really going beyond simple, and they're not even simple, but going beyond the pay equity audit, the living wage discussion, and seeing how you really can make an impact systemically on your employees through what is already defined as one of your most systemic process is around comp and benefits. The great thing about this is these benefits, by focusing there, you have an opportunity, I see, to differentiate yourself with talent. It applies to all levels of the organization, from your most entry-level position all the way up to your senior executive. And while you're doing this internally, it has the benefit of closing disparities and promoting economic stability and financial health from an external perspective as well. And so that impact that I see in this space is something that I would encourage chief diversity officers to engage with total rewards leaders to really say, what is the realm of opportunity here? So I'm going to flip the conversation now to you, Tom, and ask you a couple questions, because when I start getting excited about that Comp and Ben opportunity, when I think about the opportunity to close disparities and promote economic stability, I start thinking about how all this plays out specifically in the financial realm. Can you talk to me about kind of how you see it based on the work that you've been doing?
Yeah, Tina, I think the role of benefits has always had two major goals. One is attracting and retaining the best talent, but the other is important. It's helping people show up as their best selves at work. And if you understand the lived experiences of working families, 70% of them are going paycheck to paycheck in this country. This is not a minority. You talk about it's all levels. 75% of families making between 100 and 125 grand a year couldn't come up with $2,000 in 90 days without borrowing it. And then the financial disparities are massive. 39% of whites in this country are financially healthy, according to the Financial Health Network, which is the largest and most prestigious nonprofit related to financial health. But only 15% of blacks are financially healthy. They've got somewhere between 1/8 and 1/11 of the net worth. So even if pay is equal, they're starting from a huge disadvantage. The average black woman has a net worth of 0 in this country. Employers offer benefits like retirement benefits. 44% of blacks have retirement savings accounts with an average balance of $20,000. That's not going to create successful retirements, and that compares to 65% of white Americans with an average balance of $50,000. And women are, even in our own surveys, are twice as likely to be extremely stressed as men. And it has huge implications. It is not just about, as you said, not just about pay equity. There's all these family and environment issues. One story that struck me in the early days of Brightside was a call center worker, a black woman in Mississippi, 2 preschool kids. She was paying $600 a month for daycare. She was working a second job at Uber Eats to pay for that daycare. Her mom stole her car, and all of a sudden she lost that additional income that was paying for daycare. So her solution was to stay up all night with her kids so that they would sleep while she was at work in the call center during the daytime job. Fortunately, she was able to find us. We were able to do a couple of things. One is we could get an emergency loan linked to her paychecks so she didn't have to go to a payday lender or some of those kinds of places to try to figure this out. And we were also able to find a subsidy in the state of Georgia for 75% of her daycare costs. So they went from $600 a month to $150 a month. So she was able to get back to work, start showing up as productive. I think there's two silver linings behind the story other than the personal progress that she made. One is that she could be helped, right? There were real solutions for her problems. There were real benefits out there. Generally, only 50% of the benefits that are community, civic, religious are being claimed in the United States. But it's not just that. There's other, you could just stop the financial services industry sometime from beating up on these people, whether it's the payday lenders or the banks themselves that collect $36 billion in overdraft fees every year. And the other thing was, this was clearly costing the employer, right? There's no way she's showing up as her best self when she's not sleeping. And just the stress of money causes 64% of Americans to lose sleep every year. So they should be motivated to help. It just has a huge impact on the employee's ability to show up as their best selves. 20 days difference in absenteeism every year between people who are financially stressed and people who aren't. You think about it, if 50% of the country doesn't have $500, then when there's a $500 car repair bill, they don't have the money to get the car fixed. And they're either borrowing it at outrageous rates, or it takes them a while to figure out how to get that done. The productivity, the cognitive load that goes to financial stress has been proven to drive IQ points down 13 to 30%. They spend 3 times as much time working on their finances at work because they can't find other time to do that, and they're stressed about it. And to John's point, kicking it off, according to the American Psychological Association, 72% of all stress is caused by finances in this country. And stress makes you sick. There was a great study just sent to me last night. It was an article in Men's Health, but it referred to a 20-year study of causes of heart disease. The top of the list was financial stress, right? And they talked about how much worse that is in Black men in particular in causing their heart disease. And I saw at Accolade, we had this idea, this notion that we got from Dr. Saul Wiener at University of Chicago on, basically what's now called social determinants of health. But even if it's not social determinants, it's all these non-medical factors that get in the way. And 80% of people have these kinds of things in every healthcare episode, every doctor visit, every time they called a company like Accolade for help with their healthcare. And 70% of that time, it was finances. It was like, 40% of people in this country skip a doctor visit every year because of finances. 25% skip a scheduled procedure. They're skipping medicines. 50% of Americans take their meds as they should. It drives the most waste in healthcare. And so basically this financial stress makes you sick, and then it keeps you from getting better. And so it's just got this huge impact. So there should be huge motivation for employers to address this. And then especially if you want to retain a diverse workforce, right? People who are under financial stress, which again, only 15% of Blacks are financially healthy, are 2.2 times more likely to turn over than somebody who's not under financial stress. So if you want people to show up as their best selves, you've got to tackle this problem.
So, Tom, I'm going to connect the dots a little bit here, especially since I'm truly in a virtual setting and can't even see your face. So I talked about MLT and our need and our desire for organizations to truly improve and measure equity as it relates to changing systems and impacting employees. And then you have talked about there are natural inequities that individuals space, and those individuals are our employees. And those inequities come in financial disparities, health disparities, educational disparities. And as organizations think about how do they bring together that impacting on systems with these disparities that their employees are dealing with in addition to the workload, it feels like, there's this basically Maslow's hierarchy of how you can start bringing these two ideas together of institutional change and individual needs as a way to creating an equitable work environment. And so it feels like financial health falls in, going back to Maslow, but in that basic safety and security that allows all the other benefits to kind of build upon that and really drive that systemic equity that my organization is looking to put in. Did I capture that right?
Yeah, I think so. It clearly is fundamental, Tina. I mean, most families are going to work to provide financial security for themselves and their families. And when they don't get it, you can see why they're 2.2 times more likely to turn over, right? That's the reason they're showing up for work, yet they still don't get it. And it creates this unbelievable stress, and it magnifies every other workplace stress, right? If your relationship with your bosses, right, all that kind of stuff, it's like, oh, that could impact my finances. And it's just, and it is addressable, right? They can tackle this. Willis Towers Watson did a study that said this is the benefit people most want. They feel is least well addressed by their employer. Like, retirement is interesting, but I don't have a lot of money to sock away for retirement. I can't even think about that right now. Like, help me with my finances right now and help me deal with this financial system that is beating me up and taking advantage of me. And, billions of dollars being spent to make it easy for me to do the wrong thing with my money. Somebody help make it easy for me to do the right thing. So, what we see is these benefits are biased, financial benefits are biased towards people who have money. I mean, retirement benefits help people who have money to put away better than they help most of the families that don't have $400 for an emergency. You think about health plans. If you have a health plan and you're not addressing the financial health piece that is making people sick and is keeping people from getting better, it's this most important social determinant of health, then your health plan isn't tackling the huge majority of your workforce. If you have a workforce that looks like America, and employers that are trying to address this with financial wellness and education, that's just the reason only 5% of people use that is it's not really a product people want. Coaching and help, they want real solutions, right? They don't want to be told, hey, you should do this with your money. And those benefits are much more attractive to people who are starting to get a little money to invest. And that's just not most Americans. So we sort of created this category called financial care instead of financial wellness to be similar to healthcare instead of just health wellness. Wellness is for generally healthy people, making them healthier. But these people are sick. 60% of the country has a financial shock every year, and that's in good times. It was a lot worse during COVID. And, the other thing employers are doing that feels inappropriate is they're letting the bad guys in to make things worse, right? They're letting these point solutions in. They're letting lenders, paycheck lending and earned wage access and some of these things. I mean, these companies make their money from providing loans. They make their money from giving people a few days advance on their pay. That is not going to make them financially healthier. Those are good treatments. They're good painkillers in an emergency, and we offer those kinds of products on our platform. But it's like just offering opioids in the cafeteria, right? You wouldn't do that. It's just those companies have the wrong business models. Even a student loan, I saw a question on student loans, right? The right answer for your student loan is very different depending on who you are, where you are in your career, and whether or not you've got 30 grand in credit card debt, right? Those things are all important to address. So, it can't just be coaching. It's got to have real solutions. It's got to be, we've got this human element that does the legwork, right? That goes and finds the daycare benefit in Georgia, or calls a bunch of places and negotiates getting your car out of the shop and all that kind of stuff. It's just a lot more effective than a pay increase or bonus. If you look at the results we're getting today, we're engaging 50% of the population that is making under 100 grand a year. We're putting on average $1,200 in the pockets of these families we serve. So it's the equivalent of a $600 after-tax pay increase targeted to the people who need it the most. We've got a net promoter score of 90. We saw a 42% reduction in people with subprime credit scores. Like, that $1,200 doesn't even count the future savings those people have on mortgages and car loans because they've got a prime credit score now instead of subprime. And we're seeing a 41% difference, reduction in turnover of people that use Brightside. And so, this is a solvable problem. It's just a matter of using good product design and behavioral science in designing your benefits, right? Provide benefits that make it easy to do the right thing, right? Healthcare, all the investments we've made to make everything hard, so you don't make a mistake, and nobody's been making the right thing easy. And then, as I said before, in the world of finance, billions are spent every minute, it seems like, on making it easy for people to do the wrong things with their money. Who's making it to the right thing? So with that, team, so maybe just given time, go ahead.
I think we're going to say the same thing. I can't see it, but are we getting some questions about kind of this intersection between equity and financial care?
Yeah. Somebody asked where the statistics can be found. I can cite sources for all the stats and a bunch of others. Just connect with me on LinkedIn if you want to do that. I apologize we don't have that. Some of it also may be on our website. A lot of these stats are there, and you can look at the references. There's a question, what % of Blacks are financially healthy? The number is 15. I highly encourage you, there's great work by the Financial Health Network. If you just search for Financial Health Network and look at their annual study they do, and they're now doing every 6-month snapshots. It's been very interesting to see what's happened in the pandemic. The health of Americans has actually improved, financial health, slightly because of these stimulus checks, but not for women and people of color. The financial statistics as it pertains to other races, just on that stat, Latinx 24% healthy compared to the 39% for white, and Asian Americans 39% healthy. And Financial Health Network has data on women as well. So a lot of questions on the data and the studies. Again, feel free to connect with me if I can be of help. Any other questions? There's actually some other questions in the attendee chat, student loan forgiveness and all these things. I'll just tell you, I think for ROI, having a financial care program that addresses these needs today is going to be a lot more effective than just giving people money. Obviously, giving people money helps their financial health. But if they're still being taken advantage of by their bank, they're still paying overdraft fees, they're still paying, outrageous interest on credit cards. I mean, there's more payday lenders in this country than McDonald's. And payday lenders are serving working people, right? These are not, you got to have a paycheck to get a payday loan. These people need better options, and as Richard Thaler, who won the Nobel Prize in Behavioral Economics, said, people aren't stupid. Life is hard, right? And you just got to make it easy for people to do the right things with their money before, I say before you start giving them a lot more money. And it can't be provided by a company that makes money off of loans or or assets under management. That's just that it's got to be somebody who's totally unbiased and is getting paid by the employer.
Yeah, I was going to say, I think that analogy between sort of payday loans and opioids resonates. I think that it is just that short-term fix. Then people get kind of addicted to that, right? Effectively.
Yeah, I think so.
I mean, one question I have, and I just inserting myself in a bit as we move towards the end of the session, and it comes from the fact that we had this discussion about mental health yesterday, and one of the things that sort of looms large in that conversation is around stigma. And I've always thought that the stigma around financial well-being is actually far worse than it is around sort of what we generally think about around mental health. I mean, I'm working on an event at the moment. It's very easy to find people who are prepared to openly speak about their depression or their anxiety. It's hard to get people to turn up and show me a copy of their visa bill. I mean, there is a real shame and stigma attached to struggling financially. Is there not?
Yes, there is, John. I think two things. One is, I think if you can make the help easy to access and people believe it has real solutions, they'll use it. I mean, what I found at Accolade, and we're seeing at Brightside, people will talk about their very, diseases, conditions, or substance abuse, other kinds of things that have a lot of shame associated with it, if they think they can get real help. And the other thing is, if you think about what the biggest issue is in mental health these days, it's supply and demand, right? And I think there's been a lot of great innovations that help address the stigma by, you don't have to spend a bunch of days trying to find the right provider, right? That just complicates the stigma, right? You can get access now online through telemedicine for behavioral health issues, but it's also time to address the demand. If 75% of stress and anxiety is caused by finances, maybe I can reduce demand for behavioral health by going at that problem. And I think that's, I think we're headed towards a behavioral health epidemic in this country. And I think this is something employers should address is, can I just reduce the demand side of it? Make sense?
No, absolutely. But you did comment that overall people's financial being seems to have improved somewhat because of government checks during.
Very slightly. I mean, you're talking about
very
overall.
normally,
I gave the stuff by race, but overall it was like 28% were financial healthy. Now it's 29%, and it's just stimulus checks are going to be short-lived, I think. Tina, I guess one more question for you, since you have been a DEI leader in a couple of companies and are now talking with them. I mean, what do you think is the role for them in tackling this?
As you all were having that last bit of conversation, that's exactly kind of where my head was going, especially thinking about this audience. So, first of all, one of the roles and responsibility of the DEI leader or chief diversity officer is to bring that innovation agenda to DE&I. How to move beyond some of the traditional programs to really seeing the realm of possibilities across all functions with a DE&I lens. And so when I think about, in this comp ben world, typically we stopped at pay equity and living wages and really haven't gotten to the impact of benefits. And so for DE&I leaders to become more knowledgeable and think about how not only this can impact and address the people that are within their organization, how it can have a bigger impact in the community, right? Because once I learned, to keep with the analogy, that opioids or payday loans have some alternative ways, I'm going to share that within my family and within my community. And so not only are those resources going to provide the immediate impact to an employer's employees, those employees will take that learning and share it more broadly. Because with healthcare, right, you can't take your health benefits and extend it to your family. But with this financial care, a lot of the solutions are publicly available. And so it becomes even a greater advocacy to changing the organization. So that innovation and that agenda. The second piece is what they do day to day, is just ensure that this is aligned with their business strategy and that they can get the measurable impact. It was great when you saw all the questions around the numbers and the data, right? And so how you can create your business case based off of those benchmarks. And finally,
thanks, Tina.
I truly believe that the combination of addressing disparities and helping people show up with their best selves at work is the core responsibility of DE&I. So why wouldn't we get involved in this?
Yeah, thanks, Tina. And as one of the questioners just asked, what will this do for the overall U.S. economy? It absolutely helps. I mean, just the cost of racism is a cost to all of us. So I think we're at time. I really appreciate everybody's time and questions. And feel free to reach out to me on LinkedIn if you want to talk more. This is something I'm obviously pretty passionate about.
I know. I think obviously, and thank you to you and Tina. Sorry, Tina, you were just about to say something.
I was just going to say I too am on LinkedIn, Tina Moore Gilbert. If anyone wants to learn more about MLT or our Black Equity at Work program.
Okay. And of course, people can visit your virtual booth or sign up to receive information from you to give permission for that. And it's clearly you're doing great and important work, and I appreciate you coming out and sharing that, because this is not something that gets discussed enough, and it's clearly something that's of increasing importance. With that, we'll close. We're going to take a 5-minute break, and then we're going to our next, I think it's our final set of concurrent sessions, one on Native Americans and First Nations, and the other on sort of the sort of everyday aspects of diversity. So pick which session we go to, and I will go rush off and chair one of those. So thank you all very much. Thank you.
Thanks, John. Thanks, everybody.